So today we're going to be demonstrating how to administer subcutaneous fluids to a bearded dragon. The reason that we do this, and the reason we teach people to sometimes do this at home, is because we might have a bearded dragon that is dehydrated or has some kidney problems, and by giving them fluids underneath the skin to absorb systemically, it helps give their kidneys a little bit of a break, flush out some of the toxins that are building up and make them not feel well, and hopefully give them an opportunity to heal. So this is a really important part of maintaining their hydration and hopefully quality of life by making them feel better. So for this instance, we are treating Princess Leia. And Princess Leia is going to be getting 6 mils of Normasol under the skin every other day until we recheck her blood work in 2 weeks. So when we send people home, we often will send an entire liter bag like this. Plus we will send a bag that has a combination of syringes and needles. So we'll start by getting Princess Leia on a soft surface and having somebody hopefully to assist, although it is not always required to have someone help. It's always nice to have an extra set of hands. So we're going to take out of the bag one syringe. This is a 12 ml syringe. We're only going to be giving 6 mLs, so it's right to the 6th line. It's a half of this syringe. And we're going to take out 2 needles. One is an 18 gauge, one is a 25. Now this is a little bit confusing. The 18 gauge is pink, it is larger, and the 25 gauge, even though it's a higher number, is blue, and it's actually smaller. So we're going to use the 18 gauge, which is larger, to draw the fluids out. Then we're going to change and put the smaller needle on to give the injection, because that will help hopefully decrease any discomfort and potential for bleeding when we go through the skin with the needle. So these come packaged sterilely. We open it up. This is not threaded. It's just a gentle kind of press on. Once it's pressed on, we just pull directly out like this. Okay? Now these bags have a port. It's a rubber port for entry. You're going to take your needle and pop right through the rubber port and draw your fluids out. I usually draw up a little more than I need. Then I'm going to withdraw, turn my needle up, get out bubbles, and just squirt to the 6 ml. Now, people get worried about bubbles. The reason is because they've heard that, when you give bubbles intravenously, you can hurt or even kill an animal or a person. And that is true. We don't want to inject air into the veins of an animal or a person. But remember, this is not going intravenously. This is going subcutaneously. If we get a little bit of air under the skin, it's okay. Nothing bad is going to happen. So don't worry about it. I certainly don't intentionally want to put an entire, mil or 2 of fluids under the skin, but if I accidentally did put some in, it's going to be okay. So I've got my 6 mils drawn up. I do now want to change this needle to put the smaller one on, as I described. I'm going to open up. This is the smaller needle. Now to take this off, I'm going to give it a little twist and pull, okay? If I pull directly, it's going to do this. So even though it's not threaded, it's just a twist and pull right off. And then this pushes right on, okay? Now, to give the injection, I'm going to give the injection, and this is true for all reptiles. We want to give any injections in the front half of the body. We do not want to give the injections back here, even though we do have some extra skin. And the reason has to do with the fact that they have a renal portal system that will actually absorb the fluids or any other medications first through the kidneys before it goes through the body. And we'd like to avoid that if possible. We want it to go through the entire circulation of the body first and then pass through the kidneys at the end. So I'm going to go for the front part of the body. And my goal is to give the injections in some of this extra flappy skin here that you can see. Where you going, Princess Leia? So, I have an assistant here today, which is great. If I didn't have an assistant, I might just use a towel to kind of keep Princess Leia calm and give my injection this way. But for the sake of doing, of giving you some perspective of what it would look like with a person helping, I'm going to use Christine today. So she's going to just hold the front and back end stable. Again, I'm pulling my cap off the needle, a straight pull, all right? I'm going to come in here, take this extra skin, and I'm just going to gently pop my needle in, all right? Just like that. So now I am under the skin, and I'm going to start injecting. And you can see it's kind of filling a bubble here. Now sometimes, especially in reptiles, this might get tight, and I may choose to actually inject this into a different part of the body just so I don't get an uncomfortable tight spot. You can see there's a tiny little bit of blood here. That's okay, nothing wrong with that. And I'm going to come on this side, and I'm not going to change the needle. I'm still very sterile here, and I'm going to just come in and give my injection under the skin here and make another fluid bubble on this side. And then I'm just going to pull straight out, okay? So these two bubbles are going to absorb over the next 24 hours or so and hopefully make Princess Leia feel significantly better. Now lastly, when you're finished, you're going to take these needles off. These need to be discarded differently than normal garbage. You don't want to just throw this in your trash. So you have a few options. You can take these and put them in a plastic bottle with a cap on it and discard them that way, or you can bring them to us and we can recycle them in our medical waste. But don't just throw them in your garbage. There are some risks that you could get in trouble if someone's going through your trash and they find this. If you have any questions, please give us a call. We're happy to help. But otherwise, this is all you need to do.